thank you for inviting us to come and talk this afternoon about our Healthy Communities Together programme. As Jonathan mentioned, I am the Director of Commissioning, Improvement and Policy for Croydon Council, and I have my colleague Laura Jenner here, who's the Deputy Director of our One Croydon Alliance. And I'm going to hand over to Laura to take us through the first couple of slides. Over to you, Laura.
Hi, good afternoon, everybody. So I'm Laura Jenner, I'm Deputy Director of One Croydon Alliance. So first of all, I'll just give you a little bit of a background on Croydon. So we're a really diverse borough. Over 50% of our population actually come from a non-white background. And we've got some real pockets of deprivation. Some areas we're in the top 5 deprivated areas in the country. But equally, we have got a very vibrant town centre. We've got a big business district, and we've got some amazing green spaces. And this is really why Croydon is a really good place to develop the Healthier Communities Together programme. We have got a really vibrant voluntary sector and brilliant community spirit. And also Stormzy comes from Croydon, so give you an idea of the culture that we've got. So alongside having a vibrant voluntary sector, we also have the One Croydon Alliance. So this is similar to what you were just talking about in Plymouth. So our alliance started in 2017, and it's made up of Health Authority, local council, our mental health trust, our GP Federation, and currently Age UK. And this is a contract, it's a 10-year contract that sets out the programmes that we are working on over the next 10 years. We very much started on supporting the elderly population, and had some really big programmes, really sort of supporting people to live in the community independently. We've now expanded and very much looking at more prevention and the whole population. And also really sort of looking more at our inequalities in the borough and how we can use the partnership that we've created to really sort of tackle those inequalities and develop a better and stronger sustainable health and social care system. So really, because of the work that we've been doing in One Croydon over the last few years, we've already really developed quite a lot of the partnership working within the voluntary and community sector, but it's definitely one area that we want to grow. And moving into prevention, this is where the development needs to happen. And it's been actually a really interesting journey working with the NHS, who don't really didn't really understand what voluntary sector meant and kept referring to volunteers. So we've really had to educate some of our NHS staff on what actually can be possible within the voluntary and community sector, and how important it is to develop those relationships and joint initiatives. And that's where we'll see the improvement for our patients. So we were really successful about 18 months ago to get a small pot of funding from the King's Fund to help us build on the work that we've been doing in the Alliance. So the funding has been allowed us to sort of engage more with our voluntary and community groups on how we can develop the partnership working across health and social care, and to develop those prevention services to support the health and well-being of our local communities. So over the past 18 months, we've had a really wide engagement programme, working, as I say, with all of the partners really on what it is that we want to achieve with the Healthier Communities Together, what was important for our voluntary sector and statutory. And I'll just sort of pick out some of the sort of main things really that people wanted us to concentrate on. So there's a real ambition about making sure that residents and community are right in the heart of all the service redesign, but it not just being when we wanted to redesign something, but that it was an ongoing basis. It was something that happened all the time, and that, you know, they were empowered and would, you know, take ownership of what we would call our sort of commissioning plans, and it's something that they would draw up and own and work with us on implementing. Another big thing, as I've sort of talked about, is about creating that community prevention offer, and it being, you know, the frontline offer would be both statutory and voluntary, working together. And obviously for us to do that, there's got to be a shift in funding. And this is, I think, one of the things we've been working on. It is quite ambitious, but we are looking at how we can, you know, shift some of the resource from our acute into the voluntary sector, so that we can, you know, really develop the offer of prevention from the voluntary and community groups. Another big thing that came out was to ensure that voluntary groups have a really strong voice within our governance structure. So we've done very well in Croydon, within One Croydon, of developing a very strong governance structure, and with the ICS coming in, we've been doing a lot of work to ensure that it's not just one or two of the big voluntary sector voices, but that we create a governance that allows the grassroots organisations to have their voices, and beyond some of the big boards. So there's some of the big things that have come out. I'm now going to pass you over to Bianca, who's going to give you a bit more of an overview of the work streams that we've got within the Healthier Communities Together. Thanks.
So as Laura described, a really ambitious programme built on already strong partnerships, but coming together and setting that vision together was really, really critical in terms of us as partners all owning what we were trying to achieve and the ambition that we were trying to deliver through the programme. And we set about, you know, in true form following function style, setting up the work streams and the governance to mirror those kind of key areas of priorities that we were looking to deliver. So we've got a local voluntary partnership board, which is chaired by a colleague from the voluntary sector. And underneath that sits 3 work streams: empowerment, engagement, leadership and representation, and funding and commissioning. And they're responsible for delivering those key ambitions that were set out on the previous slide. So empowerment engagement is really looking at engaging local communities in co-producing services and activities to really deliver that transformation that we're aiming to see. And that is chaired by the VCS colleague. Leadership and representation, again, you know, picking up on what Laura said, it's not just about kind of where voluntary sector organisations and relatively large voluntary sector organisations sit in our existing governance structures, but it is also about ensuring the voice of smaller groups get heard within the programme, but also in the wider health and care system. And then the funding and commissioning work stream, and that is the work stream that I co-chair with the Director of Commissioning from the CCG, or now the Play Space, in Croydon. And that is where we have been looking to develop our locality commissioning model, and we've also been looking at other ways of working differently with the voluntary sector to not only kind of shift the resources, but also about some of the responsibility around commissioning. So breaking then down those kind of ambitions into kind of a series of agreed actions, in each of those work streams, we set about establishing what our activity was going to be and what we needed to do to ensure that we were delivering the vision at the end of that 3-year programme. And there's some more detail here in terms of each of the work streams and the key areas that they set themselves kind of as actions to deliver by the end of the programme. And just to pick out a couple of the key ones from my perspective, in terms of the empowerment engagement work stream, there is a real focus there around outcome metrics. So, you know, outcomes-based commissioning has been around for a long time, hasn't it? But actually, you know, really specifying good outcomes and delivering good outcomes is quite a difficult thing to measure. And whilst we really didn't want to, you know, spend the next year talking about outcomes measurements, it is also really important that we do understand, you know, the outcomes that we're delivering for people. And I liked a lot of the metrics that Plymouth were talking about, actually. So we're definitely going to probably steal some of those. In the leadership and representation work stream, you know, one of the key bits for me was around the leadership training and development for VCS leaders. And we have seen some local alliances forming in the voluntary sector in Croydon. There's one, a really strong one that's just kind of formed and is getting up and running in relation to mental health provision. But a real ambition amongst, you know, the bigger voluntary sector organisations to develop some of that kind of systems leadership with some of the smaller organisations in Croydon. And then in respect to the funding and commissioning work stream, so that's the one that I have responsibility for. There were two key areas that we sought to develop and deliver in that work stream. One was around our locality commissioning model, and the other one was looking at where our current spend is in the system and how much of that is currently delivered by the voluntary sector, and what the opportunities there are for the voluntary sector, you know, working with us to commission and also to deliver other services. So in respect of the locality commissioning model, that is something that we have been, you know, really excited by, and I'll come on to talk about that in a little bit more detail in a moment. Just in terms of where we've got to with the spend analysis, so as a system, you know, one of the ambitions of the programme is around, you know, the transfer of that resource, and it's not only the finance, it's not only the money, it's also the power, you know, the delivery. So, you know, that's one of the key ambitions of the programme. And obviously to understand, you know, how we were delivering against that ambition, we also needed to understand what our current position was. So we undertook spend analysis against all of our health and care spend as a local system. And we broke that down to understand what proportion of that is in scope potentially for being delivered by the voluntary sector, should they wish to deliver some of those services or some of those outcomes, but also how much of that that's in scope actually we are currently commissioning from our voluntary sector partners. And just to give you a bit of an idea of the numbers, of our total health and care system spend is about £728 million. 15% of that as a group we worked through, and it was, you know, as a group of partners we worked through that and deemed about 15% of that to be in scope for potential delivery or co-commissioning with the voluntary sector. And of that 15% in scope, only 11% is currently commissioned with the voluntary sector, of which 7.5 of that is with the local sector. So again, Laura talked about, you know, a real vision in our acute sector to think about how we can shift resource and some of that power into the voluntary sector. And as you can see from those numbers, there's significant opportunities for us to do that, and that's part of the programme that we're working on next. It would be remiss of me not to mention that, of course, there are challenges. As I said, you know, the One Croydon Alliance is a really strong partnership that's been operating for a number of years now, and actually that gave us the basis for, you know, developing the Healthy Communities Together. Actually, the programme developed quite well because we have those really strong partnerships already locally, but we can't deny that there are some challenges, and not least the funding position of our statutory sector partners is an ongoing challenge. Certainly in Croydon, we've had to deliver quite a significant amount of savings in the last financial year, or this financial year we're just about still in, aren't we? and that will continue into the next financial year. And of course, there will be, some impact as we look at decommissioning on our voluntary sector partners. So holding that conversation at the same time while we're working really hard with them to look at opportunities for them taking on, further resource and responsibility has been quite challenging. But actually, as a partnership, we're all really, really committed to the medium long-term vision, and recognising that whilst we're having to take some difficult decisions in the short term, actually we've got to keep sight of that medium to longer term vision and keep doing all the work that we are through the programme to get us there and to be able to deliver that. And there are ongoing issues about, if I'm going to be completely blunt, our ambition is bigger than our budget. So a lot of the work that we've been wanting to do, and our voluntary sector partners are really, really keen to do around the development of those community hubs and engagement with community groups, obviously do require a level of resourcing, and that is in excess of the budget that we've currently got in terms of developing the programme. So there are ongoing conversations about how we balance our ambition with our resource available, and as partners, we're constantly looking at how we identify additional resource to be able to contribute to the budget so that we can really fulfil our ambitions. So we've set out again in each of those three work streams some of our current achievements and where we're looking to go next. And I just wanted to draw on a couple of more of those, and I am really conscious of time, so I'll try and keep this brief. Going back to Laura's point around engaging communities and it not just being when we want something from them. I'm delighted we've got our community partnership events now that happen in each locality. And that is ongoing engagement. It's not just when we want to go and talk about something. The agendas are owned by those local community partnerships, and we ask if we can go along and join them when we want to go and have a conversation about something. So that feels really exciting. It's very grassroots. It's people in the local community coming together to talk about what's important to them. Just to touch on the locality commissioning model, and I think this is possibly one of the things that I've been really, really proud to be working on. It is about working with our local partners in the voluntary sector at a locality level, but also working with those local communities to determine what outcomes they want to see at a local level, and what services there are currently available and what commissioning we want to do at a very locality level to deliver those really good outcomes for people. So it's very person-centred and very community-centric in terms of developing those commissioning intentions, but also putting the community at the heart of commissioning, which comes back to that point about relational commissioning. We are working at the moment to shift the resource. We've identified a pot of funding that we're going to be putting into that locality commissioning model, and we're working with our community and our local voluntary sector to work through the detail of how that could work in practice, but essentially shifting that power and resource into the voluntary sector and into the community for them to be able to lead on that commissioning. So I think really, really exciting. We are at the beginning of that journey. We're just testing it out and piloting in one area at the moment, but we're really hoping to prove that proof of concept and be able to roll that out. And as we do prove that concept, actually start to develop additional pots of money that can start to go into that locality commissioning model. So I think what I would, the message that I would leave with is start small but think big, and that's really what we're trying to do in Croydon. Thank you.
That's fantastic. So much. Thank you so much, Bianca and Laura. Really interesting to hear the Croydon experience and the kind of parallels with what's going on in Plymouth.